I mean, I think I will say, I'm glad you asked the question because I think when you look at the dialogue around global health financing, the voice that's missing in the space is the implementer's voice, the NGO leader, the community-based organization leader. You hear from the philanthropists all the time. You hear from the government leaders all the time. And I say this as someone who's formerly at a think tank, or you hear from from think tanks about how we should do this better, but you really rarely hear from the implementer. What is their perspective on how global health financing should work optimally? And so what I would say to NGO leaders out there is they're in a difficult position because it's hard to be critical of the way global health is financed because
It's your funding,
you
right,
sort of have
too.
to criticize, you have to be a little bit critical, hopefully constructively critical of the folks who are funding your work. But there's really been a lack of dialogue over the years between the funders and the implementers. It's been a one-way street. It's funders who have by and large dictated how this works. And I think the consequence of that has been NGOs who do not have the sort of financial resilience to withstand a shock like the one that we saw this year. And that's why you're seeing just, thousands of
Mm.
NGOs shutting their doors. International NGOs, local NGOs, they can't withstand the shock. And it's partially because of the way the space is financed. And so there needs to be a much, much better dialogue between funders and implementers to make the process more efficient, more effective, always with a view to the end beneficiary, who are the communities and the health systems that we're all working to strengthen and improve. So I would encourage them the first thing I would say is we've just decided to try. We don't know if it's going to work, but we're going to try to solve this on our own. To some degree. I mean, this is not the only way we're going to mobilize revenues, but hopefully it's another, right? It's another avenue for mobilizing revenues. So I think you can think creatively. You don't have to sit around and wait for the folks in the space to sort of solve the problem. And I would also encourage them where they can to reach out to funders and have that dialogue. And I would say to funders in the space that they really need to reach out and have a dialogue with implementers. There's not enough dialogue on how to improve how grants are designed and structured.
To
You know,
align
I
incentives, right?
Yeah, I mean, it's
In that
just
long-term sustainability.
yeah. Everybody, donors talk about scaling and impact and sustainability, but nobody wants to pay for it. I mean, I've been doing this for a long time. Nobody's paying for scaling for the most part. You just don't see scaling grants. Everybody says they want a scalable solution, but they don't want to pay to scale it.
Understood.
So we have an issue. Kudos to, somebody like Mackenzie Scott, who is, and not everybody has to follow her model, but I think her model is great. She's basically saying, listen, organizations like HealthRight have been doing this for, 36 years now. We know what we're doing. We have a proven track record. We have deep relationships in communities and on the ground. We are, as an organization, we don't employ expats. Our staff are members of the communities that we're partnering with. We are deeply connected to both the problems that these communities face, as well as with the solutions that they need to overcome those challenges. And so that, just giving organizations the cash to be able to sort of creatively solve it is a wonderful thing. Not everybody has
Yeah.
to do that, but at least she's thinking a little bit differently, and that's great to see.